our continuing partnership with the Columbus Medical Association, we're going to discuss glaucoma.
Please welcome back our health team ophthalmologist, Dr. Alice Epitropoulos. And Dr. Epitropoulos, what is glaucoma?
Glaucoma is a condition where the pressure in the eye is higher than normal, causing damage to the optic nerve and visual field loss. It's the second leading cause of blindness, affecting 1 out of 50 Americans over the age of 35.
Is that almost, it's the blood pressure in the eye then? The same way we'd have our blood pressure taken in a doctor's office, you do that as soon as we come into your office then, correct? Who's at risk?
Well, I think everybody needs to be concerned about glaucoma and its effects. It's important to get your eyes checked on a regular basis because early detection and treatment is the only way that you can detect visual field loss from glaucoma. There are risk factors that put some people at more risk than others. Those include, first and foremost, age. As we get older, our risk increases for glaucoma. Those with a family history of glaucoma should be monitored more closely. African Americans, diabetics, and even people that are nearsighted are a little bit more at risk. And then lastly, those that have had long-term treatment of steroids or previous eye injuries are more prone to developing glaucoma.
Doctor, what are some of the obvious signs that would drive someone for a screening? What would be the obvious signs that perhaps there's a problem?
Well, the disease is known as thief of sight, okay, because there are no symptoms, okay? So patients that have, been diagnosed with glaucoma and, where their symptoms, have vision loss, it's most likely, if they have vision loss at that time, it's irreversible. It's really too late. In fact, over 2 million Americans have glaucoma and don't know it. So again, it's important to get their eyes checked and detect glaucoma early.
I don't think we can mention this enough. Tell us again, doctor, how, who needs to be tested and how to be tested for this?
Well, the only way that you can find out if you have glaucoma is getting an eye exam. If glaucoma is suspected during your eye exam, more specialized testing can be performed just to kind of monitor for any progression of glaucoma. It's suggested that those over the age of 45 get their eyes checked every 2 years, unless there are risk factors, in which case you ought to get your eyes checked every year. Now, if you've been diagnosed with glaucoma, it should be even more often than that.
Doctor, we just have a few moments left, but what about treatments? What's available?
Well, we've come a long way as far as treatment. When I was young, my grandmother was blinded by glaucoma, so there weren't a whole lot of treatments at that time. But now we have a variety of eye drops, eye lasers, surgical procedures that we have available to treat glaucoma. The whole purpose of treatment is to control the intraocular pressure to prevent loss or further loss of vision.
Alrighty, doctor, thanks for joining us. All good information. We'll see you next month.
Coming up, the Flag New York